Hey, everybody, Dr. Talks World. I just want to give a shout out to some new science. I'm Joel Kahn, medical doctor, preventive cardiologist in suburban Detroit, host with Joel Furman, MD, of the upcoming Reverse Heart Disease Naturally Summit. Very excited about that. But how about a natural therapy for blood pressure, for anxiety, for depression, coming right out of the medical science? Always looking for clues like this to try and reduce or avoid medication. In my practice, and I'm sure you're looking for that too, in your patients, in your family, and your loved ones, and even in your own life. So let's go to the science for just a minute. And in the British Medical Journal, not a bad scientific journal, is a study this week called Cross-Sectional Associations of Different Types of Nature Exposure with Psychotropic, Antihypertensive, and Asthma Medication. First author, Turunen. And what they basically did is they had an environmental health survey in the Helsinki area from 2015 to 2016. There was 7,321 participants. They had data on how many times a week they went into green spaces, blue spaces, water, forests, parks, backyards. How many times a week, not just how many minutes a week they went into these spaces, how many of these were actually around their house using zip codes and an urban atlas to figure this out. And they correlated it with self-reported needs for anxiety medication, hypnotics, antidepressants, antihypertensives, and asthma medication. They also factored in other health behaviors like smoking and blood pressure and diabetes, air pollution, socioeconomic status. Was it really spending time in the green that helped, or was it, possibly a confounding factor? The background of this is, of course, something you've probably heard of called forest bathing. For the past almost 40 years in Japan, this has been a common practice in Japanese called Shinrin-yoku, spending time in forest green spaces by bodies of water to gain better psychological and physiological advantages and health. What did they find in this new Helsinki Capital Region Environmental Health Survey? They found that the number of times a week that a person responded they were in green spaces and lived near green spaces and used their green spaces, they lowered the odds of needing psychotropic medicine by a third. And if they actually got into those spaces more than 5 times a week, the green spaces, it was more like 40 to 45% reduction. Blood pressure medicine, about a 40% reduction by more than 5 times a week getting in those green spaces. Finally, asthma was equally powerful, about a 30 to almost 40% reduction in people reporting that they were taking asthma medication just by being outside. And when they looked at how many minutes a week, it wasn't quite as correlated. It was how many times a week was the strongest predictor. Socioeconomic and other medical factors didn't confound the analysis. They concluded frequent green space visits, but not the amount of residential green or blue spaces. You actually have to go to them. You have to spend time in them many days a week, or green or blue views even. If you can look out your house and see a lake or a forest or trees, that's a nice little shortcut too. Were associated with using less medication like psychotropic, antihypertensive, and asthma medication. Very exciting project, no funding conflicts, of course. Nobody in the green space industry was paying for this. So tell it to your patients, tell it to your family and friends, share it with your neighbors, that green spaces, bodies of water, there actually has been a tradition. Doctor, I can't get out in the forest. I have a physical or other infirmity that doesn't allow it. That viewing beautiful oceans, beautiful forests, actually on a landscape on your computer can actually substitute to a bit. But I'd always encourage you to take the effort to do the walk in the woods, do the walk in the green space, get by a body of water as often as you can. What a great message for natural health. Thank you, drtalks.com community.